Connor.
I'm trying to let all these people in. I'm distracted. Let's see. Okay, here we go.
Next slide, please.
Oh, there we go.
Yeah, this one. To begin my presentation, I will give some background information about my country first. Afghanistan is a landlocked country located at the crossroads of Central and South Asia. We Afghans call Afghanistan the heart of Asia. However, in the last 5 decades of war, the heart of Asia has suffered more than any other parts of Asia. As you can see in the map, we have a long border with Pakistan and Iran in the south and west, and we are also neighbors with China, with Tajikistan, with Turkmenistan, with Uzbekistan in the east and in the north. Some of you might know that the famous Silk Road, which was an important trade route between the east and west, was passed through Afghanistan. And that is why Afghanistan has always been a strategic country. Next, please. Our country is also the birthplace of famous scholars and poets such as Rumi, Nasser Khosrow, and others. It is very sad to see a country with rich history and great scholars in war in the last 5 decades. Next, please. In terms of demographics, Afghanistan is almost the same size of Texas, and in terms of population, it is almost equal to California. Around 40 million people are currently living in Afghanistan. However, the majority of the population is young adults, mostly under the age of 30. According to World Bank, fertility rate was around 4 births per woman in 2020, while it was around 7 in 2000. You should not be surprised when you meet an Afghan family, you should not be surprised by the number of their children. For instance, I myself have 7 siblings, and some of my friends, they have around 10 to 12 siblings. However, the trend is changing now. The new generation, and especially those who are educated, they don't want to have a lot of children. Next slide, please. As I said in the previous slide, the majority of population is young age, and that makes Afghanistan one of the countries with the young population around the world. In this slide, you can see that almost 47% of the population is under the age of 15, and another 27% of the population is between the age of 15 to 29. And you can also see in this slide that a very small proportion of the population is under the age of 60. Next, please. About the Afghanistan's history, we have long and rich history. Afghanistan has more than 5,000 years of recorded history. Beside our rich history, we also have some beautiful historical monuments in the country. In this slide, you can see the very beautiful blue mosque located in the Mazar-e-Sharif city of Balkh province in the north of Afghanistan. Afghan Shias believe that the grave of Hazrat Ali, the cousin and successor of Prophet Muhammad, is located in this mosque. However, the other Shias in other parts of the world, they believe that the grave of Hazrat Ali is not in this mosque. It is somewhere in Najaf of Iraq. the very important thing about this mosque is that people from the country, they come together on the 21st of March, which is the first day of New Year in Afghanistan's calendar. We call it Nowruz, which means New Day. The people from all over the country are coming in Mazar Sharif, and around this mosque, they celebrate Nowruz there. Unfortunately, with the new regime in the country, they are against the Nowruz celebration, and they didn't allow last March people to celebrate Nowruz. And they were not allowing people when they were previously ruling Afghanistan to celebrate Nowruz. They think that Nowruz has something with religion, which I don't believe in that. I think Nowruz is a tradition even before the rise of Islam. Next slide, please. In this slide, you can see the beautiful minaret of Jam. It is a UNESCO World Heritage Site in Western Afghanistan. I'm very happy it is still there and no group has destroyed it during the ongoing war. Next slide, please. In this slide, you can see the famous Buddhas of Bamyan. There were two 6th century monumental statues named Salsal and Shamama. Salsal is the name of the male Buddha, which is taller, more than 150 feet, and Shamama is the name of the female Buddha. They were carved into the side of a cliff in the Bamyan province of central Afghanistan. Next, please. You can see the two Buddhas in this slide carved out of the mountain. I tried to find a picture where you can see the Buddhas in one picture. So I ended up with this one. On the left, you can see the male Buddha, which is taller, and on the right, you can see the female Buddha in the two sides of the mountain. And you can also see a view of the beautiful valley of Bamyan city province in the center of Afghanistan. Next, please. Unfortunately, these Buddhas were destroyed by the Taliban in 2001, which shocked most of Afghans and the entire international community. In 2001, before the collapse of their regime, they decided to destroy these Buddhas. Next, please. In terms of ethnicity, there are 4 major ethnic groups in Afghanistan: Hazaras, who look like Asians, Uzbeks, Tajiks, and Pashtuns. However, there are some other ethnic groups as well. Hazaras in the last 5 decades have been the main target of terrorist groups because of their facial features and their religious difference. Next, please. In this slide, the data in this slide dates back to 2014 from CIA World Factbook. It says that, you can see it says that 42% of the population are Pashtuns, 27% of the population is Tajik, and 9% are Hazaras and Uzbeks, and another 4% is Aima, 3% Turkmen, 2% Baluch. However, Afghan Hazaras, Afghan Tajiks, and Afghan Uzbeks, they do not agree with this percentages represented both in here and in the census of the Afghanistan's government. Afghan Hazaras, Tajiks, and Uzbeks believe that the real percentage of the ethnical groups have been underreported because of the political interest in the government. Next slide. Afghanistan is an Islamic country, as most of you might know. Around 99% of the country's population is Muslim, less than 1% of Afghans or Hindus and Sikh and other faiths as well. In the past, we had Jewish community and Christian community in Afghanistan, but today we don't have those two communities in our country. I heard in the news that the last member of our Jewish community was evacuated from Afghanistan last August when the international community left Afghanistan. In Islam, we have two main sects, Shia and Sunni. The majority of Hazaras practice Shia Islam and other ethnicities are practicing Sunni Islam. That is also a reason for targeted killings of Hazaras, because the Hazaras don't practice the same sect of Islam with other ethnical groups. The terrorist groups have always targeted this particular ethnic group. Next, please. In terms of language, the two most spoken language in Afghanistan is Dari and Pashto. Those who are Tajik and Hazara, they speak Dari, but Pashtuns are speaking Pashto. To be clear, Dari and Pashto are two different languages, both in writing and speaking, and even the alphabets are different. The majority of the people, including the Pashtuns, they can speak Dari. However, most of the Dari speakers, they cannot speak Pashto. Also, Dari and Farsi are very similar in writing, but when it comes to speaking, Dari is slightly spoken differently than Farsi. The accent is also different. As we all know, Farsi is a dialect spoken in Iran, and most ordinary Afghans might not understand some Farsi words. If you're dealing with an Afghan family, it is always good to ask for a Dari translator if you could, instead of just a Farsi interpreter. Because sometimes the translation will be misinterpreted. For example, if an Afghan patient says, I have pain in my dil is a Dari word, refers to the heart, the Farsi interpreter would translate it that the patient has pain in his or her heart, because dil means literally heart in Farsi. However, many patients in Afghanistan and many ordinary people in Afghanistan, they refer to abdomen as their dil. So you see in this example, the difference how the concepts will be misinterpreted. If you're a healthcare provider, always ask your Afghan patients to show you where the pain is coming from. That way you will not miss the point of the patient. Even myself as an Afghan, when I was practicing back in my home country, I was always asking my patients that where actually the pain is coming from to show me. That way I was not missing the point of the patient. Some other local languages are Uzbeki, Pashai, Baluchi, Turkmeni, to name a few. Next, please. In terms of the health and healthcare system in Afghanistan, in 2001, the healthcare system was totally fragile. However, in the last 20 years, we made some very good improvement in health sector. For example, life expectancy raised from 55 to 62. Child mortality decreased from 100 in 2000 to 47 in 2018. And maternal mortality decreased from 1450 in 2000 to 638 in 2022. About the mental health, although the prevalence of mental health disorder is very high in the country, but it is a taboo in Afghan culture. Most of the people refer to mental health problems as being crazy. That's why it is not explained as a clinical problem in Afghanistan. The main reason of mental health problems is the ongoing war that people have experienced some sort of trauma directly and indirectly. The other reason as a physician, I think, is that we don't have a lot of psychiatrists and psychologists in the country to address the mental health problems. In the whole country, we have had a limited number of teaching hospitals training the residents in the above fields. As for medication, you can get any kind of drug without prescription from a pharmacy in Afghanistan if you know the name of the drug. It is very easy. You go to the pharmacy and ask them, hey, do you have this special drug? For example, let's say, do you have propranolol 10 milligram, and I need 50 tablets of propranolol from this company. And the pharmacist, without any prescription, the pharmacist will give it to you and will tell you, here you go, sir. It is as simple as that. So in Afghanistan, if you are a physician dealing with an Afghan patient, explain for them that the medications you have given to them is enough, because most of the doctors in Afghanistan are prescribing a lot of medication for their patients. When the patients come in a foreign country like the United States, and if they receive less medication, they will doubt the knowledge and the expertise of the doctor. So it is always good to explain for them that the medication you have given them is enough and they don't need extra medication. One another thing that I would like to share with all of you, and that is that a lot of Afghans share their medication with their family members, with their friends and relatives. You need to explain to them to don't do that. In Afghan culture, it is very usual if somebody, for example, let's say have a headache and he or she has taken a medication that worked for them, and another family member or friend is also having a headache, then they will suggest that I took this tablet, this worked for me, and I suggest you take this. Next slide. About the culture, in Afghan culture, when ladies do makeup, they put a very thick black eyeliner. It is called surma or kajal in Afghan culture. They also use surma for newborn babies for the first few years. Some people believe surma is good for eye and making your eye strong, and it is also warding off the evil spirit. But as a healthcare provider, we know that surma is not good because surma contain high level of lead. A report from FDA in 2022 also said that surma contain high levels of lead. Again, if you are a healthcare provider, you may tell your patients about the harm of lead, especially for the children. About the Afghan costume, the ordinary Afghans dress up like this in their home and in special ceremonies like a wedding or New Year. Many people in the West, when they hear about Afghan women, they imagine Afghan woman with a blue burqa. I would say burqa is not part of our culture. It is imposed on us. And many people in main provinces of Afghanistan before the Taliban time were not wearing burqa at all. The beautiful and colorful clothes that you see in this slide, this is our culture. This is our colorful culture. Next slide. Again, if you're a healthcare provider from cultural perspective, females will not feel comfortable with male interpreters. If you could, ask for female interpreters. Also, another advice would be, except the spouse of a female, they don't feel comfortable to talk about their health problems with other male family members, especially about gynae and OB topics. Another cultural point you should understand, in Afghan culture, most of the time, you don't say no directly to others because it is seen as being impolite. Instead of that, they will say that they will try their best or inshallah. However, in many other Islamic countries, inshallah means a perfect yes, but sometimes in Afghanistan, if you hear an inshallah from an Afghan friend or an Afghan patient, then it doesn't mean a certain yes, it sometimes means a polite no. Some of my American friends were telling me that I talked with this particular Afghan and I told them, hey, could you do this? And they said, inshallah, but then they didn't do anything. So this is a cultural thing that you should be considering. The other thing in Afghanistan is the taboo of number 39. You should be aware of number 39 in Afghan culture because this number is related to prostitution. I don't know how this came in our culture, but it is related to prostitution in many provinces of Afghanistan. I, as a physician, were struggling with some of my patients if we were admitting them to room 39, and sometimes we needed to escape number 39, not only in the hospital, but also in other societal traits, like even if your car's number plate contains the number 39, then the price of your car drops significantly. There's one misunderstanding between Afghans and Afghanis. Some people use these both terms interchangeably. So the Afghan is actually a person from Afghanistan. A person who has the citizen of Afghanistan is Afghan. So Afghan is the person. And Afghani, on the other hand, refers to the currency of Afghanistan. So I would suggest that these two should be differentiated. Next, please. Now, I would like to talk a bit about the last 5 decades of civil war in Afghanistan. It started with the invasion of Soviet Union on Afghanistan. And since then, we have not seen a single peaceful day in the country. Afghans believe that their country is the graveyard of empires. Neither the Alexander the Great nor the Soviet Union were able to occupy Afghanistan. Next, please. After the Soviet Union left in Afghanistan, the Mujahideen who claimed victory started fighting amongst each other because they didn't agree on distribution of power. Mujahideen is an Arabic word, and it means those fighting on behalf of the faith and those fighting to keep the faith safe. When the Russians left Afghanistan, when the Soviet Union, I should say, left Afghanistan, then the Mujahideen started fighting with each other because they didn't agree on the distribution of power. And this actually resulted in the rise of Taliban in 1994 in a Western province called Kandahar in Afghanistan. Next, please. The Taliban were able to take over most parts of Afghanistan by 1998. When they captured Kabul, they hanged the former president of Afghanistan, Dr. Najibullah, and his brother in a street in Kabul in front of the public. In this slide, you can see, I blurred actually the picture of the president and his brother. You can see that they have hanged the president and his brother in front of the public in a street in Kabul. And also Taliban imposed restrictions as they did this time on women's education and work. Next, please. It is sad to say that we are one of the fewest countries in the world. Instead of going forward, we have gone backward. You can see the difference in these photos. The photo on the left is the photo of Afghans before the invasion of Soviet Union. And the black and white photo that you see where it says before the Taliban is a photo that Afghan students or Afghan female students are going to university. Then you see the Afghan woman during the Taliban time with blue burqas. And after the Taliban was defeated by international troops and Afghans in 2001, then the girls and the women, they returned back to school. Next, please. During the Taliban regime, Afghanistan became a safe haven for terrorist groups such as Al-Qaeda. And that's how they managed to attack the US on 9/11. A few months after 9/11, Afghanistan was freed from the Taliban and other terrorist groups with the help of US and NATO. Afghans in general and minorities in particular become hopeful for a bright future. Next, please. With the help of international community, the United States in particular, we have a lot of progress in the last 20 years. Minority communities such as myself was able to get a higher education during this period. You can see the Kabul of 2021 and the Kabul of 1996 under the regime of Taliban. Some people in the West think that the presence of their countries didn't make any change in Afghanistan, and their countries shouldn't stay in Afghanistan and they should have left Afghanistan. But as an Afghan, I would say the presence of your countries in Afghanistan made such a great change in Afghanistan. Afghanistan improved in the last 20 years a lot in terms of education, in terms of economics, and in terms of healthcare, and the presence of your countries actually made this possible in Afghanistan. Next slide, please. In this slide, you can see in 2001, Kabul was a ghost city, a ruined city. But in 2021, you can see that Kabul became a city of hope, a city of development, and a city more than 5 million people were living. You can see how much Afghanistan has improved in 20 years. Next slide. In this slide, you see the historical Darul Aman Palace. During the 5 decades of civil war, this palace was destroyed completely. You can see in 2001 that the palace was destroyed completely. In 2021, with the help of the international community, the palace was rebuilt. Next, please. I arrived in the United States, as Dr. O'Connor explained, on August 1st, 2021. Although things were not okay, but no major city was in the hand of the Taliban. Within 15 days of my arrival in the US, the whole country fell. I, like many other Afghans, was shocked. Everything we built and worked for in the last 20 years with so much struggle and hard work fall apart so quickly. We were not even imagining such a thing to happen. Education, economy, healthcare system are all collapsing in the country now. Believe it or not, more than 50% of the people are trying to leave the country. Unfortunately, again, we are witnessing the repeat of history. It is so sad that the rights of women and girls, the most vulnerable population of the country, is being violated on a day-to-day basis. Girls above grade 6 are not allowed to go to school. In 21st century, Afghanistan might be the only country not allowing the girls to go and get an education. It is also sad that the whole world is silently watching, and particularly the Islamic countries, those big Islamic countries such as UAE, Qatar, Iran, Kuwait, Pakistan, they don't at least condemn this act that the Taliban is not allowing the girls above grade 6 to go and get an education. Next slide, please. Within a month, we changed from happy and very colorful people to silent and all black from head to toe. From joyful and cheerful that you can see on the right in this slide in a stadium in Kabul, to sad and sorrowful. I quote Dr. Cornel West, who said, "You can't lead the people if you don't love the people, and you can't save the people if you don't serve the people. No regime will be stable if you don't love and serve the people." This is my message to the people who are ruling Afghanistan now. Next, please. And now people in Afghanistan are selling their kidneys on the black market to feed their families, as the country is facing extreme poverty. You see that poor Afghan men, they are showing the scars of the surgery that they did in hospitals. Some of the people in the West believe that this is just only on the news, but as a physician, I have treated and faced with the patients who actually sell their organs, such as kidneys. Next, please. And now people are selling their young girls to survive, or simply they're not able to feed them. I don't know what is the sin of innocent children like this girl in this slide, who is not able to have a peaceful and a comfortable life like many other children around the world. Next, please. This poor mother brought her daughter next to a street in Kabul to sell her. You can see the card in her hand, which is written in Farsi, Furushi asked, and it is translated in English for sell. Humans, especially innocent young girls, are being sold like objects in my country now. They didn't have any rule in the war or politics, but they are the real victims of the war, and the war takes sacrifice from them every day. Next, please. Here are my recommendations as an Afghan physician to other healthcare providers, volunteers, and community members. More than 80,000 Afghans have been evacuated to the United States last year, and most of them don't have a living status, and they don't know what will be happening to them here in the future. I request your advocacy for them, that a pathway should be provided for them for getting a green card and citizenship in this country. Also, many Afghan families struggle in the beginning with the education and the healthcare system, which is very complicated in the United States. Especially the healthcare system is very complicated, and the new Afghan arrivals, they struggle with this. They don't know which schools are good for their children. Your assistance will help them a lot for smooth settlement. Finally, they need your help with employment too. Most of the families in here have extended families back in the country. Now that the country is sinking in poverty, their only hope is their relatives in the US. Good paying jobs will not only help the newcomers in here, but also their extended families in Afghanistan who really need help at this difficult time. Next, please. Lastly, I hope one day my country is freed and the people of the country is living in peace without the fear of surviving and selling their organs or children. Thank you very much for your attention. I will now take any question the participants might have.
Oh, that was just amazing. It was even more powerful than when we practiced it, and you said so much more. So thank you for that. I even learned something the third time through the presentation. So I'm going to open up the webinar to anyone who would like to ask Dr. Azeemy questions. They can be clinical, they can be about taking care of an Afghan family or neighbor that you have here, anything about the amazing, rich culture of Afghanistan. You can put questions in the chat, or you can unmute yourself and ask a question. We still have people joining the webinar. So there are brand new people who just joined in.
I tried to finish my presentation sooner because I thought to give enough time for the participants to ask questions.
Well, I'm going to kick it off a little bit because you've been here and you've actually just returned from Boston. So I was going to ask you, and you mentioned the very complicated nature of the healthcare system in the United States. And we're always talking about the differences between systems. So what would be an Afghan's expectation of going to see a doctor or engaging at a hospital or a clinic? Do you make appointments? Do you just go when you're sick? You know, I think that it's always helpful for people to understand what they had experienced in their home country before they came here.
Mm-hmm. That's a great question. Thank you for asking that, Dr. Connor. As I explained in my presentation, the healthcare system in the United States is very complicated. Even for me as a physician, it is very complicated. In the beginning, I was not able to understand the healthcare system in here until I read about it in my courses in my MPH program. So now think of an ordinary Afghan. If it is complicated for me, then how complicated it will be for an ordinary Afghan. In Afghanistan, although we have universal health coverage, the governmental hospital is free for all Afghans, but the services in the governmental hospital are not good at all. In the last 20 years, one development that we had in the health sector, we were able to build so many private hospitals in the country that we didn't have before 2001 in Afghanistan. And now these private healthcare providers are filling the gap, and they are providing very good healthcare services for the population. In Afghanistan, it's very easy to see a doctor. You don't need to wait for a week or more than that. You just go to a hospital, and some doctors even they have their own small clinic. If you're feeling sick, you just go to their clinic and wait for an hour or for 30 minutes. Sometimes if the doctor has a lot of patients, then you wait for, let's say, 2 to 3 hours. But usually you get the treatment in the same day. However, in the United States, it is not like that, especially if you want to go and visit a specialist. I found out that visiting a specialist or seeing a specialist is very complicated in the United States, and sometimes it takes up to months to visit a specialist. So these are the differences between the healthcare system in Afghanistan and in the United States.
Thank you. We had a question in the chat, Dawood, about what are your recommendations for helping new Afghan women feel more comfortable in the United States?
Mm-hmm. As I said, that around more than 80,000 Afghans have been evacuated last August, since last August. And among them, we have a very big female population as well. I know some Afghan females who came in the United States, but their families are not with them. So that is one problem, that these especially the Afghan females who are not with their families in the United States, they might need a lot of help from their American friends in here. In Afghanistan, we have big families, and the people of Afghanistan are living all together in one family. It is very rare that you find, especially a female, to live on their own. When they come in the United States, they have to live alone with a roommate in a room. Even in Afghanistan, the females do not sleep. Most of the females do not sleep alone in the room because we don't have a lot of rooms, and there's always one other family member, a female family member, who is sleeping with you in the same room. But in here, they need to sleep in their own room. And some females that I met, they were telling me that they are scaring during the night, and they don't feel safe. And this created some sort of mental health problems for them. So the whole Afghans, and particularly the females, they need the help from American friends a lot.
We're getting a lot of questions. Another question, and probably you might want to talk a little bit about the variation in observance around Ramadan, but what are some typical attitudes, practices, or views for pregnant and breastfeeding women and fasting during Ramadan? And do you have any suggestions for how to address those concerns respectfully? Because I'm sure that, how much people practice it can vary based on which community they are from.
Mm-hmm. So as I said, the majority of the population in Afghanistan are Muslims. And no matter if you're a Shia Muslim or a Sunni Muslim, you practice Ramadan, you take fast. In regards to your question, in Afghanistan, the religious scholars, they were saying that if a woman is pregnant and if they are breastfeeding, then there is no obligation for them to take fast. They can break their fast, and when they are out of their pregnancy and when they are not breastfeeding, then they can take fast at that time to compensate the days that they were not able to take fast during the holy month of Ramadan.
So there are two other questions that are one's related, and then we're going to switch topics. This is sort of the one person asked if it was usual that hospitals would be just for women and children, which is where you worked. So they may not have been when we introduced you. That are all of the hospitals in Afghanistan segregated for females only? And what is the common practice in Afghanistan for women to marry? Because there was a question around seeing women here who had been married at a very young age, say between 13 and 15.
Mm-hmm. To respond to your first question, most of the hospitals in Afghanistan, it is not divided based on gender. Although I was working for a hospital so-called Mothers and Children Hospital, but it was not only Mothers and Children Hospital. We had services for the male patients as well. However, there are some maternity hospitals where the patients are only mothers who are pregnant, women who are pregnant. About your second question, can you repeat the second question, please?
Typical practices for the age that women get married.
Okay. In the past, the decision was mostly made by the family of the boy and the girl. But nowadays, in many cities of Afghanistan, the decision is mostly made by the boy and the girl themselves, but the family always has a very big role in influencing your decision. The family, will come and give their idea, but nowadays the family are not imposing, that you have to marry this particular person. However, what I explained is different based on different ethnicities in Afghanistan. For example, some conservative ethnicities still, the family will decide for you who you're marrying, but some other ethnicities, they're more liberal and they will not influence. They will give you suggestions, but they will not decide the final decision for you. Nowadays, in some very far villages of Afghanistan, still we were hearing reports that the family forcefully married a very young girl, to a very old guy. So that's happening in some parts of Afghanistan, but comparing to 20 years ago, the proportion has decreased significantly.
There's also a follow-up. There's obviously a person who's very interested in the way that hospitals are staffed. So are the women's obstetric hospitals, so hospitals for pregnant women, are they staffed by only female providers? They're having some situations, I guess, in other communities where maybe an emergency situation to deliver a baby, if there's not a female practitioner available. What can you help us understand about how best to take care of that situation?
Mm-hmm. In maternal hospitals, the majority of the employees are female healthcare providers. But in other hospitals, the one that I was working, even in the OB and gynae ward, we had some male doctors, nurses, and other healthcare providers. And that was not a big problem at all. But in a province, probably in a village, having male healthcare provider might be kind of problematic.
So here, probably the recommendation would be to just explain that this is the situation and this is what's available.
Exactly.
And I've been through that situation. I was at the hospital and you helped me through it. So we're going to switch topics a little bit from healthcare, even though that's your expertise. You are also an expert in education. And one of our amazing community members over at Indian Creek is asking us to talk about the differences between the Afghan and the American education system. And his specific question is, what is the one thing that a school can do to best meet the needs of their new Afghan students. And we know this is coming from our good friend, Principal Bibi's staff. So they want to take care of those 150 new Afghans they have over at Indian Creek in the very best way.
Mm-hmm. That's a very good question. And also a very difficult question because he or she asked one specific thing. As a person being involved in education, I would say if we understand the culture of Afghans properly, and if we met the expectation of the families, then they will comfortably send their children to your program and you will be comfortable with them. So always contact with the family, especially the decision maker of the family. So it is a very important point. You need to pay attention. Sometimes we talk with a family member and that family member is not the decision maker. If you're able to find the decision maker of the family, usually in Afghan culture, there is one person, the decision maker, and that is the elder of the family. Either it is a grandma or a grandpa, or the dad or the mom. If you find that that decision maker and talk with them, your work would be much easy. If you talk with other family members, then they are going to tell the decision maker, then the message, in the middle of the way, some will be cut, some will be added, then it would not be very efficient.
So I know that we have our COVID ambassador team on this call because I see them all participating. And I wondered if you wanted to talk a little bit about COVID vaccines and attitudes towards vaccination. It was a surprise to me to learn how open Afghans are to medicine and how they like to share medicine. So I wondered, I think we've seen a lot of success with vaccination in the Afghan community, but I wondered if you had any experiences or wisdom to share with us around that.
Mm-hmm. Thank you very much. In the beginning, when the vaccines were introduced in Afghanistan, many people didn't believe in vaccination at all. They were thinking that, there is a chip inside the vaccine. And if you get the vaccine, then the big and giant technology companies, they will be tracing wherever you go and whatever you do. So those kind of rumors were all around in Afghanistan. Some other people, they were saying, because this was spread in the social media, people spread the news that if you take the vaccine within 2 years, the vaccine will actually kill you, because the population of the world is getting larger and larger. The developed countries, they came with an idea, let's create COVID and then give vaccine. Through these two interventions, we decrease the population of the world to make the world a safer place for the people in the future. So that these were the kind of understandings in the beginning. But eventually, when some people, especially the healthcare providers, they took the vaccine, then the idea of the people changed. In big cities like Kabul, Mazar-e-Sharif, Herat, the people were eagerly coming to take vaccination. Again, in conservative communities and villages, there were some resistance in taking vaccine. Those who came in the United States, those Afghans who came in the United States, the majority of them came from Kabul and other big cities of Afghanistan. So I think most of them will not resist with vaccination and they will take their COVID vaccine.
Well, we're almost out of time. We are out of time, and there's still a lot more that we could ask you, probably for the rest of the evening. But I want to thank you so much for sharing your extremely powerful message. I'm incredibly honored to know my Afghan friends. You know how much I've been having a good time, especially eating. So I would like to leave it with one final tip. If you could just talk to us a little bit, teach Americans about what we should do when we go over to an Afghan's home. What should we expect, and what are the common practices, and what to expect when you go, because what are the usual welcoming customs when you go visit an Afghan?
Okay, thank you very much for bringing this up. In Afghan culture, when you go and visit the home of an Afghan family, they usually prepare the tea for you with some dry fruits. And if you don't eat their tea or their food, they will take that as an insult for them. They will think that this person didn't like the tea, or thought my dishes were not clean, or they will bring a lot of reasons. So it is always good when you go and visit your Afghan friends and Afghan neighbors. It is always good to sit with them and drink a glass of tea with them, and it will make them very, very happy. And if you eat their food, there's a saying in Afghanistan: when you eat our food, then we share the food, then we become family. And if you eat their food, then they will become so close with you. And if you didn't eat their food, then they will think, okay, they didn't like our food probably, or probably we are poor, and a lot of other reasons. So it is always good to explain for them. And if you have kind of allergy to the food, tell them that I like the food, but because I have allergy for certain foods, that's why I'm not eating this food.
Very good advice. And the food is amazing too. I encourage everyone to make an Afghan friend if you don't have one already. Well, I think that we're going to wrap it up for this time. We are going to post a recording of this webinar on our prc.gsu.edu website. And I just want to thank Dawood for being here, for being so open, and for giving us such a strong message and a call about what we all can do as individuals to welcome our new Afghans and make them feel more comfortable here, as well as a call to understand that we all need to be aware and conscious of what's continuing to happen in Afghanistan. It's ultimately the world's responsibility. And I think that was a very powerful message. So thank you for your courage and your honesty. And I hope everyone has a great evening, and tune in for our next webinars coming up. You can find them on our prc.gsu.edu webpage, and I look forward to the next one. Thank you, Dawood.
Thank you very much, everyone, for your patience and listening to my presentation. I hope it helped you guys to deal with your Afghan friends and neighbors. Bye-bye. Have a great afternoon.